The next step in IVF procedure is an operation which is called egg collection. Even though it is a surgical procedure, there is no actual cutting or stitching involved in this. It is just a needle which is as thin as the needle that you use for daily injections that goes inside the ovary and collects the follicular fluid from each of the follicle, and then it comes out. So the recovery after egg collection is almost instantaneous because there is no cutting or stitching involved. So basically what happens is, when the patient comes to us on the day of egg collection, she will be fasting for 8 hours. Then we insert an intravenous cannula which is inserted into the vein in the hand, and through this we give her medications to give anesthesia. Also there will be oxygen and inhalational gases involved. So at the time of anesthesia, the patient takes maybe 1 or 2 minutes to go off to complete sleep, and then we start the procedure. Just like we performed a scan, a routine scan, a transvaginal probe is inserted, and in that there is a slot for the needle to go. So the needle goes inside the ovary, collects each follicular fluid. From each follicle the fluid is drained, and then the needle comes out. The fluid inside the test tube is passed on to the embryologist, who is the scientist working in the embryology lab, which involves the eggs, the sperms and the embryos. The embryologist looks at the follicular fluid under the microscope and gives us a real-time information about how many eggs have been collected. At the end of the procedure, which lasts somewhere between 20 to 30 minutes, the patient is brought back to awake state from her sleep. So once she wakes up, she will feel a little bit of dizziness, grogginess, so we allow her to rest for another 1 hour in the recovery period. At the end of 2 hours after egg collection, she is free to go home. The rest of the work happens in the embryology lab. The same day, the husband is required to give a semen sample, which will be used for injecting inside the eggs. So once the patient goes back home, the embryologist will proceed with the process of icsi, where each sperm is injected into an egg. And then they are kept inside a specialized equipment inside the embryology lab called the incubator. The incubator creates the same kind of environment which is present inside the fallopian tube of the mother. The carbon dioxide, oxygen, the nutrition, everything is going to be the same. So the egg will behave as if it behaves inside the fallopian tube of the mother. So once the sperms are injected, we keep the egg to fertilize inside the incubator. And the incubator will also be fitted with camera inside, so we can observe how the embryos are behaving inside from the exterior without having to open the incubator, and this system is called embryoscope. So the next day, the embryologist looks at the embryos and gives a call to the patient to know how many embryos have formed. And these embryos are further grown. Just like a child grows up, these embryos are grown from day 1 to day 5, and depending upon the age, the clinical condition and the embryo quality, we individualize how many embryos are to be transferred to each patient.